Hello, I'm Julie Miller from Focus on Dementia, and today I'm in conversation with Dr. Andrew Mackay, who is Quality Lead for the East Edinburgh GP cluster. And Andrew was pivotal to the success of improvement work undertaken in the cluster, and that was to test relocating dementia post-diagnostic support into primary care. So thank you, Andrew, for joining me to chat about what's taken place over the past few years. Really appreciate you joining me today. So for our listeners, Andrew, can you say what your vision was for the work in the cluster and was it realised?
So when the prospect of getting involved in this first came up, I was really interested because I thought that the question the Scottish Government wanted answered of whether it would be a good idea to place post-diagnostic support for dementia into primary care. I thought that was a really interesting question. I've always been a massive enthusiast for having services very closely linked to primary care, and having it actually intrinsically part of primary care I thought was a wonderful opportunity. I also felt that there were some gaps that could be filled better than the existing services were filling them. There were restrictions about who could and couldn't access dementia support through the existing services, and I thought we could influence the way a service was set up to fill those gaps and maybe do some things in an innovative manner. So that's really where it started, and yeah, and we were delighted to be one of the teams chosen. It then went through a slightly frustrating stage as we were trying to get it all up and running, and it took a while for people to be appointed and for us to clarify our vision, and that was all something that for me, who's somebody not familiar with this sort of work, I found myself champing at the bit to get going, and I couldn't get going in the way that I wanted to, but we got it sorted and we got up and running, and then I think it was really successful for a variety of reasons, and I think we did deliver something that was effective, that was well liked, that integrated well with the existing services, and provided something a bit new and a bit different.
Yeah, I would agree, Andrew. And we've obviously recorded Becky, the project manager, and Joan, who is your dementia support facilitator, in the role who delivers pre and post diagnostic support. So, so if anyone's listening to this, please tune in to hear more about their roles in the programme too. And Andrew, what would you say have the benefits been to to your practice and to the cluster by having, your own dementia support facilitator?
So there are specific benefits for patients, and that is right at the very beginning of this journey. We have lots of people who approach us and say, or relatives approach us and say, we think that they might have dementia, or they think that their memory's not so good, but the person themselves is not particularly wanting to explore that. They don't like the idea of being referred to a clinic. And so we can ask Joan to see them and to just discuss memory problems, because even people think, oh no, I don't want to think about dementia, I've just got a poor memory. And we can get Joan to speak to them about memory problems in a general manner, and talk about and help support them engaging in the journey of diagnosis. So there's the whole idea that you have a specified, knowledgeable, skilled person who can engage with people with cognitive impairment is something that isn't available in any other way. So I think that was really helpful for patients. And then she could follow them through so that if they did get a diagnosis, they could go back to see Joan, and that gives some consistency of message and of individual, because clearly this is a group of people for whom it can be difficult meeting new people and getting to trust new people. So that was really powerful. The other benefits are that it just coordinates so much better with primary care, because Joan was writing all the notes in our primary care systems. We immediately knew everything that she was doing, and that doesn't exist with the with secondary care based services. And so it was really powerful, that integration. And And then there were all the other little benefits that actually you don't necessarily see when you're doing analysis. But because we were talking about dementia a lot, and because we were engaging with other services more, the knowledge base and the awareness about dementia within all the clinicians in the cluster, I think, improved. And we saw a significant increase in the number of diagnoses of dementia
Yeah.
through the course of this project, because I think just exposure was increased, and again through the project and the connections we made, we accessed a variety of different training things for different practices through the cluster, whether that was about buildings or about the managing the legalities of different capacity assessments and things like that. The broad spectrum of different training, and that was all really helpful too.
Yeah, yep. And I think the other thing that we noticed too, that there was a very good uptake of the support pre and post diagnosis too. And I think because GPs are actually speaking to patients about it, that people are perhaps more inclined to take up the support if it comes from the
Yes,
GP practice. Yeah, yeah, that
absolutely.
was a great feature too.
Yeah.
Yep. And what's the future for the work, Andrew, in your cluster and wider?
So um, the um, that hasn't been completely straightforward, I think it's fair to say. We've got additional funding for continuation of Jones Post for a couple of years
Great.
um, in our cluster, and there has been a realization that there is a big gap. We have a situation where there is increasing number of people with dementia. There are big delays in the diagnosis locally. And so there are a lot of people sitting there who almost certainly have dementia who aren't getting any support because they haven't got a diagnosis. And there are still a variety of different services that are delivering dementia support, whether that's outside of Scotland, that's our service, the mental health care teams, and it isn't potentially as well coordinated as possible. So I know that there's a realization, and the work that we've done has helped identify this, that there is a realization there is a role for trying to coordinate the whole of dementia support much more effectively in Lothian.
Yeah.
And I know that they're looking at appointing somebody to take on that role, um, and to try and just revolutionize the way that we do that um, in our locality. I think what's also interesting is that the existing Alzheimer's Scotland support have been very interested in what we've been doing, and some of the work on anticipatory care planning, for example. Joan has been in really engaging with anticipatory care planning and documenting things on the KISS, and Alzheimer's Scotland link workers are now interested in anticipatory care planning. And I think that isn't an accident. It's because they're aware of what we're doing and they're interested in the things that have gone well.
Yeah, that's right. And I think in turn, they have also been quite a good support to Joan too. I
They
think she's had
have,
great peer support from
yes,
Alzheimer's Scotland too. So it's so nice to see that there's been sustained, I think, joint working with them
yeah,
going
yeah,
forward. So that's great, and it's great that Joan has been kept on in the cluster for another couple of years. I think we've got just so much to share and learn from your work to make dementia support pre and post diagnosis an integral part of primary care. It's been a great piece of work that you've carried out in East Edinburgh. But Andrew, I'll let you go. So thanks ever so much for talking to me. And if
welcome.
listeners want to learn more about this improvement programme, please look out for the other short videos and resources on our Twitter feed. And of course, look at Focus on Dementia web pages and watch this space to see what we do with all the learning from this programme for now. So thanks again, Andrew. So I'll let you go. Thanks. Bye
Very
for
well.
now.
Bye now.